There are three key elements of patient management for someone who is suffering from an acute renal injury. These include correcting fluid and electrolyte disturbances, treating infections, and maintaining nutrition. The overall goal of this management is to assure that renal perfusion is occurring and to avoid hypovolemia. Multidisciplinary team involvement is required for adequate patient management. This involves a collective effort from doctors, nurses, nephrologists, and nutritionists. Doctors will need to perform medication reviews, as acute kidney injuries affect the excretion of substances. An overall assessment of the patient's medications should be conducted to titrate medications in relation to kidney function, as well as assessing for medications that may have caused the initial injury. Nutritionists and dietitians will play a key role in nutritional management, particularly as these patients will experience issues with hydration and electrolyte balances. Nurses will monitor changes closely and administer medications and nutritional supplements. A comprehensive physical assessment of the patient must be undertaken every shift, including a thorough respiratory assessment to assess for acute pulmonary edema resulting from fluid overload. Regular blood tests assessing for electrolyte kidney function and metabolic balances will need to be assessed for signs of deterioration. Accurate fluid balance charts should be implemented, and the insertion of an indwelling catheter will be required. Management strategies for these patients include regular vital signs and strict fluid balance charting. Patient's volume status. If the patient is hypovolemic, fluid resuscitation using an isotonic solution is needed intravenously to maintain homeostatic functioning and to ensure that the mean arterial pressure remains higher than 65 for renal perfusion. This may involve use of vasopressors. Urinary catheterization will be needed to relieve any possible obstructions which may have caused the injury in the first place. This will also assist with frequent and strict fluid balance monitoring. If the patient is hypertensive, note for signs of edema. Introduction of diuretics or renal replacement therapy may be indicated for these patients. Prevention of infection is another key management strategy for these patients. Safe hygiene practices, including maintaining asepsis when completing procedures, is important to reduce the risk of infection. Antibiotics are to be commenced with caution as the body cannot adequately excrete these drugs when injured. IV fluids should also be administered to maintain hydration, and reduction of dietary sources of potassium to eliminate risk of hyperkalemia.